The Finance Committee meets this morning because there is nothing in our healthcare system as broken as the way America pays for life-saving medicines like insulin. That failed system has forced millions of Americans daily to make gut-wrenching decisions between medicines or other necessities of life. The drug companies have Americans over a barrel, with Medicare barred from negotiating better prices. This program that represents tens of millions of seniors and even more taxpayers has to take on Big Pharma with both hands tied behind its back. The consequences are clear when you contrast the prices Americans pay with the prices in other countries. In preparation for this hearing, the Finance Committee, our investigators, looked at pricing data for several of the most commonly prescribed brand name drugs in Medicare. We looked at the prices of top-selling drugs in the United States and in comparable Western countries, and we compared the figures from 2015 and 2020. The list includes medications for conditions such as arthritis, diabetes, and cancer. In every case, colleagues, the U.S. price in 2015 started higher than the international price. In every case from 2015 to 2020, the U.S. price went up while the international price remained flat. In 2015, Americans had been paying 2, 3, even 4 times as much as international patients paid for these medications. By 2020, that gap has roughly doubled for many of the most expensive drugs. Here's a specific example. I've got a Humira pen. It contains 1 dose. 1 dose of a treatment for arthritis, rheumatoid arthritis, Crohn's disease, and other autoimmune conditions, painful diseases that afflict millions of Americans. Patients typically inject one of these pens every 2 weeks. As of 2020, the price per pen in Quebec, Canada, was $563. List price in the United States was $2,778. Americans see this infuriating price gouging, and it's clear that Big Pharma is treating Medicare like they have cracked an ATM. Prescription drugs in Medicare may be the only case across the entire government where negotiating a better price is actually legally prohibited. It is long past time for that to change. Democrats have a plan that would finally allow Medicare to negotiate for lower prices for brand names. We focus on the costliest products, the ones that monopolize the market. In addition, our plan would cap co-pays for insulin at $35 a prescription. It would set a $2,000 out-of-pocket cap for seniors' medications in Medicare Part D and spread those costs over the year instead of front-loading them all in January. It also would create tough new price gouging penalties for drug companies that raise prices faster than inflation. And there were a lot of companies that did that early this year. A number of these ideas were developed in this committee with bipartisan support, and that remains. However, there is just no substitute, none, for the number one reform, which is allowing Medicare to negotiate like any other payer. Without negotiation, the job is just not done. For example, setting out-of-pocket caps without negotiation just passes the price on to somebody else, and that's usually taxpayers. That's not sustainable, and it just puts more pressure on Medicare's finances in the long run. Unfortunately for American patients, Mitch McConnell has blocked any changes, even the proposals that had bipartisan support, and a lot of repeating of Big Pharma's talking points against real reform. The drug companies say that allowing negotiation, and we'll hear this today, is bad for the market. Western civilization is pretty much going to end. It'll not be possible to have pharmaceutical innovation any longer. that claim does not add up to scrutiny, and we will be looking at it today. First of all, it's true that pharmaceutical companies do develop breakthrough treatments. It's also true that most of the new so-called new drugs released at higher and higher prices are actually older drugs, but they've just been repackaged in new ways. A relatively minor tweak to an old drug, say a different syringe or a change in dosage, just keeps the profits rolling in. And second, a large and growing percentage of American seniors either ration their medications or skip them entirely because they're just too expensive. Almost half the cancer patients, many of them on Medicare, burn through all their savings within 2 years. If the prescription drug market prices out millions of patients and bankrupts many others, how can anybody say that is healthy or functional for our country? I'm here to tell you the scandal is what is legal. Today, Big Pharma has a legal right to set whatever prices they wish and expect Medicare to pay them. Drug companies can game the system to maintain monopolies and protect their best cash cows. And without fail, the Republican leadership controlling the agenda for their party in Congress is out there protecting the status quo. That is a recipe to stifle innovation, not promote it. As we meet this morning, there are people all over the country who know that they're going to get mugged every time they show up at the pharmacy counter. High drug prices force people to have to make terrible choices. Far too often, choosing your health also means choosing hunger. I'm going to close with this. The American people have waited too long for action. This has been the longest running battle since the Trojan War. And the country has heard and told us what this is all about. So it's time for action. Democrats have a plan. We need to act quickly. I want to thank our witnesses. And of course, our friend Senator Crapo can be recognized now for his opening remarks.